Do you know bad production can kill a great content idea?
Do you want to have a photo shoot, audio production, or do you need a professional voiceover artist?
Do you simply want unmatched cinematography, video production, or just event coverage, such as weddings, birthdays, or burials?
Or do you need a space for meetings or conferences? All these are possible with High Impact Studios. Don't bring down your creativity, let's help you take it high.
And out of this world with our state-of-the-art equipment and first-class studio space.
We give you the quality you deserve at the best rate.
For more details, call 0706 393 5694 or 0915 958 1881. High Impact Studios, the future.
Looking for a world of education and entertainment? Get ready to dive into limitless excitement on iImpact Full HD TV. Micromsat 42 degrees east. Enjoy a packed lineup of thrilling shows, sports actions, electrifying music, and so much more. High Impact TV, securing the future.
Something big is in town. Something powerful and majestic. A mammoth creation destined to become a legend by all who encounter it. High Impact Planet, Nigeria's biggest family theme park, with facilities designed for friends, families, or large groups under a relaxing atmosphere. Be welcomed by wowing displays of animatronics, thrill out with realistic arcade games, or enjoy a number of thrilling heart-racing park rides. Experience the 5D and 12D cinemas and challenge your mates with bumper cars and go-kart races. Don't forget to slide into the ice rink or simply take time out to enjoy a pizza at our delightful restaurant and dessert spot, or at the exquisite club lounge. High Impact Planet, 12 Lagos Ibadan Expressway, Ibafo, opposite MFM Prayer City. Visit high-impactplanet.com for details and inquiries. Fun just got real.
Do you know?
High Impact Radio 102.1 FM. The future is now. High Impact Radio 102.1 FM. The future is now. Impact Radio 102.1 FM. The future is now. High Impact Radio 102.1 FM. The future is now. High Impact Radio 102.1 FM. The future is now.
Welcome to the show. It is on record right here. Every word matters. You're right here at High Impact 102.1 FM. We are live on YouTube and on X. I am Vivian Oguche. On the program, we discuss the actions, inactions of government, ministries, departments, and agencies, as well as business and health affairs that shape our worldview. The program also encapsulates personalities and institutions that make decisions that affect the lives of people one way or the other. And then we also avail you, our listeners, the opportunity to call in and make your contributions.
On record.
Every word matters.
In 2023, a house officer at a teaching hospital, was said to have slumped just after days that she returned to work. It was a very tragic event. And over the years, the subject surrounding the state of Nigerian health sector has been a growing concern in the country. Now, she was said to have slumped in church after days of coming back to the hospital after calls and being on duty without help from other neurosurgeons, in that same hospital. Although the doctor was later discovered to have suffered from underlying health issues, many people believed the stressful work condition of the hospital had been a catalyst for her death. Now, it was reported that in May 2022, a total of 727 Nigerian-trained medical doctors were said to have relocated to the UK. Now, like I said, over the years, the subject surrounding the state of the Nigerian health sector had been a growing concern in the country, from the declining facilities to the redundant service level given to patients. These factors not only take a toll on these resident doctors, but also on patients as well as other doctors who are specialists in the hospital. Now, cases around the countries have been cited consisting of doctors being used past their working hours without remuneration. Now, this sometimes people call it inhumane circumstances, faced by doctors in the country had led them to increasingly flee the country to other countries in search of greener pastures. And so today we will be discussing the declining health sector in the country and how it serves as a catalyst for continuous brain drain in the country. Now the phone line is open. It is 0700 1021 1021. You can send your WhatsApp messages to 0907 224 5018. Now we are live on YouTube, High Impact 102.1 FM, and on X at High Impact 102.1 FM. You can also watch us live on High Impact TV, on Facebook at High Impact Studios, and High Impact TV on Nicomsat 42 degree East. When we come back from this short break, I will be joined by a guest analyst who is a specialist in this field, and the discussion will continue. Stay with me.
On record.
Every word matters.
Welcome to On. 102.1 FM, your urban lifestyle station.
I just want to be here.
Do you know bad production can kill a great content idea?
Do you want to have a photo shoot, audio production, or do you need a professional voiceover artist?
Do you simply want unmatched cinematography, video production, or just event coverage, such as weddings, birthdays, or burials?
Or do you need a space for meetings or conferences? All these are possible with High Impact Studios. Don't bring down your creativity, let's help you take it high.
And out of this world with our state-of-the-art equipment and first-class studio space.
We give you the quality you deserve at the...
Welcome back. The show is on record where every word matters on High Impact 102.1 FM. We're live on YouTube, High Impact 102.1 FM, and on X at High Impact 102.1 FM. You can also watch us live on Facebook at High Impact Studios and High Impact TV on Nicomsat 42 Degree East. Now, to join the discussion, you can call 0700 1021 1021, or you can send WhatsApp messages to 0907 224 5018. Now we are taking a look at the decline in Nigeria's health sector and how it serves as a catalyst to brain drain. My guest this morning is Dr. Sunny Olukunle Phillips. He is a medical practitioner. Dr. Sunny, such a pleasure to have you on board this morning.
Yeah, good morning. Pleasure is mine. Thanks for having me.
Thank you. Over the years, the conversation of the unethical behavior of health facilities, in Nigeria had been a constant thorn in the flesh. Would you say the health sector has improved based on all the talk you've been talking over the years? Have there been any improvements so far?
Okay, thank you. When you say improvement, with regards to what in particular?
With regards to the state of medical facilities in the nation and how resident doctors and medical practitioners are being treated generally.
Okay, so that's a big one that we need to unpack and not lump all together.
Mm-hmm.
I start off most of this discussion by saying you cannot take out the health sector. You can't explore or discuss the health sector out of the socioeconomic frame of the country. It's a component of the country's socioeconomic framework. So as the country improved over the years, because the story of the country is the story of its health sector. So it's with that I would say, if we look at it from indices, which are the measures by which we assess the functionality of any country's health sector. If we look at some of the indices, maternal mortality rate, under 5 mortality rate, elimination of some diseases of public health importance, you can say we've made some progress as a country. There are still, but that progress may not be generalized, because even within the country, you have different states that are on different milestones, and some are ahead of the curve, well ahead of the curve, while some are lagging behind. No thanks to some other issues that also have crept in, like security challenges in Northeast and some regions in the north. So it's not one blanket, nor one brush that one can apply across the canvas. It has to be well unpacked. I mean, we now we've been certified free of polio, white polio strain. We had success stories with control of Ebola, control of COVID in Nigeria. So, but there are still major issues on the table, as it were. We are still responsible for almost 25% of all malaria occurrence across the globe. When it comes to HIV, we are still responsible for up to 30% of children that are born with HIV across the globe. TB, we are still leading the pack. So if you look at these issues, these core issues, we are struggling, but there are some pockets of success stories here and there.
Would you say that the containment of the recent outbreak of cholera was a huge success? Would you call that a success?
So with cholera, yes, in a way, though probably we could have responded more, or even be more agile or be more proactive. But cholera is a seasonal breakout in Nigeria. It's a seasonal issue. It's related to rainfall, or the onset of rainfall. So the way to measure is the response. I think the response is now better than before. Immediately they started reporting cases. I can bet you NCDC, working with the various states, had the necessary mechanism activated to nip it in the bud. And that's why now we're no more talking of cholera as an epidemic anywhere across the country. It shows the response that it was quite well activated. Can we prevent it? That is beyond responding to the epidemics when it breaks out. It has to do with our socio-economic framework. It has to do with our environmental planning. It has to do with our waste disposal. It has to do with our own practices as individuals to make sure we employ hygienic practices. So it's beyond just responding to the epidemic. If we're talking about cholera as a disease, it's beyond just the response. I think the response was fine, but other issues come to play that needs even non-health intervention.
In your introduction, you said it very well that we are unpacking these major issues confronting the nation's health sector. Now, when I introduced the topic of discuss today, we talked about a doctor who had slumped in 2023, and it was discovered that he had been overstressed. Now, there's been complaints of resident doctors working beyond their call time. There have been complaints of excess unit calls and uneven rate of patients to doctors, with the number of patients requiring consults grossly outweighing that of the doctors available for consultation. Is this true, doctor?
This is very true. I mean, you're even touching what you are seeing is the iceberg, is the tip of the iceberg. There are people that are medical doctors that are looking or taking up other profession now because they just cannot go. They just can't go. Yeah, I'm being very sincere with you. So it's the brain drain is real, very, very real. Globally, there is a dearth of healthcare workers, medical doctors in particular. So hardly do you find them lacking attention in some of the developed communities and countries around the globe. That's one. Secondly, the condition of service in country, because it is different for things to be exacting at the other hand. But if you can hold on to the ones you have in country, you are sure nobody wants to play a second fiddle or a second-rated citizen in another man's land. You know their leaning will be to stay back at home and offer their service. But the scenario is such that the condition of service is extremely deplorable. I chose this word intentionally. I'm a medical doctor. I've been in clinical practice before going to public health. It is deplorable. Not to talk of the sacrifices of going through the training to become a medical doctor, and then you see how better return the other colleagues that are on the other side getting, you will make the right choice of emigrating with your skill and rendering it at some other fulfilling environment. So that is the fact. That is the fact. You can't. That is our reality. And medical doctors are overburdened, extremely overburdened.
It's very unfortunate, Doctor, the picture you just painted. Now, let's talk about the reaction of... Yes, let's talk about the reaction of these doctors, resident doctors who threatened to go on strike recently because they said, no pay, no work. No, sorry. The federal government now fired back with a threat to say, no work, no pay. Then I remember what one of my colleagues on TV, on our sister station, High Impact TV, said, Sarah. She said, if the government is saying no work, no pay, do you think it is the right of the resident doctors to also say no pay, no work?
So I don't want to go into labor issues, but the fact is this. I've said this many, many times, that the doctor you want that should attend to you is the doctor that is not belabored thinking about his survival, distracted about his wealth, thinking about how to put food on his table, thinking about even how to invest in his professional growth. Let me tell you something. Even after, can you hear?
Yes, you said even after.
Even after graduating as a medical doctor, doctors invest from their pockets in their training to become consultants, to become specialists. Heavily, I know colleagues that, I'm talking of millions of naira, even to be qualified as a specialist. And life is happening along the way. So for me, whether work to rule, work, no work, no pay, no pay, no work, the reality is that the working condition is not conducive. I've seen a scenario, not so. I've been in teaching hospital where the doctors, the surgeons left the theater and they were on the protest with their theater gown on the corridor because there was no electricity supply to the theater. I wasn't told. I saw them. So I really pity the citizens of this country. I pity the general citizens because they are now the victims. Even the medical practitioner is the victim of poor leadership, of a poorly run community, of a poorly run country. That's just the scenario. I mean, the other countries that people are heading for, they are also being ruled and led by human beings like us. It's just misplaced priorities. And the fact that the folks that are in place of authority do not patronize these health facilities that they know they have run aground. Simple as ABC. If you know that is where you're going to procure your healthcare service from, you will put it in place. You will make sure it's able to respond to your needs. But when you know you will never show up there, when you know your child will never show up there, you know your wife will never show up there. With an headache, you are joining the next flight out of the country. You don't have any reason, at least in their mind now, in their deranged mind, to add value to the system. Let me put a caveat. There are governments that are responding. There are some movements in the right direction.
Okay.
Pockets, like I started off, pockets of social story, but I mean, there is a huge gap between where we ought to be and where we are at.
All right, that's very well said. We'll take a short break now. When we come back, we'll begin to take a look at how this situation can be tackled head on. Right? Thank you so much so far, Doctor. We'll be right back.
Yeah.
Every word matters.
High Impact Radio, 102.1 FM. The future is now.
Welcome back. The show is on record where every word matters. It's happening right here on your favorite dial, High Impact 102.1 FM. I am Vivian Uguche, and I got with me Dr. Sunny Phillips. We've been talking about the decline in Nigeria's health sector and how this serves as a catalyst to brain drain. Thank you so much, Doctor, for joining us again.
Yeah, welcome.
All right. So we are talking about how the decline in the health sector is a catalyst to this thing we've tagged brain drain. So it was reported that in May 2022, a total of 727 Nigerian trained medical doctors relocated to the UK. Now, do you think this is a trend that will continue to happen, even though there are instances of doctors complaining that they are being overworked over there as well? Do you think this might continue?
It will certainly continue, and I'll give you the reason. You see, in the UK, people are flooding to. Do you know there is an existing guideline to limit the number of doctors that UK can take from outside UK, particularly from sub-Saharan Africa? Do you know there is a document to the effect that they shouldn't poach our medical doctors, but you see, water will always find its level, and talent will move in direction of value.
All right.
So all these window dressing, pronunciations and pontification and policy statements. Hello, they are just scratching the surface. Brain drain will not stop. It's not going to stop in the nearest future with regards to. You're talking of doctors. It's not only doctor emigrating. Nurses are emigrating. The entire ecosystem. I'm even talking of administrators. If you go to any typical Ministry of Health now, they will see, and you check the number of personnel that were in place 3 years back. I'm talking of people with skills that can even manage healthcare service delivery. Because healthcare service delivery is not just at the healthcare facility. There are other unseen hands that are holding the facility to be functional. There is preventive care, there is rehabilitative care. So it's not just the facility that people focus on that represent the entire health system. So talent will keep on moving in the direction of value and appreciation. Until we change, until our socio-economic development gets to the point that it can showcase a functional health service delivery, the talent continue to move in current direction.
You know, one of the things medical doctors had called for government to ensure becomes a reality in the country is to put in round pegs in round holes. You asked for a technocrat in the health ministry. I know that we have a Dr. Pate now. His predecessor was also a medical doctor. Has this helped in any way, having medical doctors as ministers manning the health ministry? Has this helped in any way?
For me, if you say has it helped in any way, it's good. It's the right thing to do because a medical doctor by training has an expansive view of the various components that deliver the health service value for value chain. However, what it takes to administer a health system is beyond what you are taught in the medical school. It takes a whole lot of administration. It takes a whole lot of human relationship, because now you must be able and humble enough to walk across the aisle, as it were, speak across different professional groups and engage them effectively, that they contribute and they support whatsoever the agenda of the government is. So if you say, for me, the discussion is not even around that. The only thing I would just add is that naturally, the doctor is the head of the healthcare team. It's a team, and you should have a head. And I think a doctor that has been well trained, additionally trained as a health service manager, will be appropriate for such role. And let me add this, where we've discussed this in the health system space. Nigeria are the people that are also in charge of the agencies that are very critical within the health sector. I'm talking of your NCDC, the National Health Insurance Agency, the National Primary Health Development Agencies. These are all and several other agencies within the Ministry of Health. For the moment, we seem to have gotten it right, putting the round pegs in the round holes across this agency, and then at top having Professor Pate on top of the system. So, but it's beyond Pate. It's the whole of society. It's community engagement. It's leadership from the very top, the president. It's leadership from the state governors, because they limit to what the federal can do. It depends on functionality of local government to drive primary health care. So all this must come together to curate and co-create a functional health system.
Fantastic. Now, you talked about the UK earlier on, that this is where most Nigerian doctors are flocking to. India is another destination of choice for so many people, right? So what attributes and patterns can the Nigerian government adopt from these countries that Nigerians are running to in order to improve our health sector?
Thank you very much. You've touched on a very brilliant question. And I've said it in different fora that our answers are already here. Our solutions are in our problem. If you go around some of our major cities now, you will see Nigerians that have returned, Nigerian medical practitioners that have returned and set up healthcare facilities that are providing high quality service delivery. That even Nigerian citizens outside the country are returning home to have surgery in Nigeria. I'm not joking, reality. So if they are saying, and I told a group recently, I said, if the country is saying, what should we do? What should we do? Hello, just go to those facilities. Ask how much they are paying their staff. Ask what they have put in place as working environment. You already have an answer. Can you scale that to the degree of that level of care? Can you scale it? But healthcare is not just curative too. How much have we done with preventive medicine, with health awareness? If you stay on a radio channel in a day, how much time is allotted to health education? That is where it starts from. What about our regulation mechanism? Recently, NAFTA, got wind and broke into a particular market where the people produce adulterated drinks and the rest, brethren. And I told someone, I said, can you think of the number of people that have been rendered sick or even dead consuming those stuff? So regulation is key for healthcare promotion, healthcare promotion, health education, key for health service delivery. Universal health care coverage. When people are sick, are they covered? Can they utilize maybe an health insurance to procure their service without running into major financial dilemma? So these are everything that we can bring to bear to make our health system work. But there are many solutions in this country that if we are serious as a people, we can do a whole lot before even going to India or going to UK, where their scenario may not be so easy to contextualize for our own environment.
Very well said. You know, you said it's not rocket science, that this thing is doable, right? These countries, yes, these countries that are tourist destination, talking about medical tourism now, I learned from a very reliable source that they engage in marketing heavily. Now, you yourself just said there are very good hospitals and specialists in Nigeria here. Do you think your colleagues are leveraging on marketing tools well enough to attract tourism into the country when it comes to the medical sector?
Okay, so there are ethics in medicine. One of the major challenges we've had to grapple with is, can you you ideally shouldn't market, that's by Nigeria efforts, medical efforts. Medical practitioners are not allowed to market aggressively, actively their service. The belief is that the quality of your service will showcase you. Yeah. So the dilemma of that is charlatans are taken to the airwaves. Charlatans are in the ears of the populace. So when an individual has limited resources and is always being bombarded by charlatans and quacks, when he has a health issue, it's likely going to move in the direction of the person that are engaged in most, particularly in our environment where illiteracy is still a major challenge. So, however, we said this also amongst our peers, there are many ways of gaining attention. Now we have a social media platform where practitioners can utilize and to engage the public so that when they need to make a decision, they don't make a wrong decision as to health-seeking decision. It's not that easy because if you are tied down seeing patients from morning to evening, where will you have the time to engage social media? And so that is the trouble with our own system. People are not free even to innovate because they are just being grounded within the way of overload of patients to attend to.
You know, as we wrap this up now, recently it was in the grapevine that a patient had died on the table. A patient wanted to do a buttock enlargement but was attended to by a quack. As we wrap this up, how do we tackle this issue of quackery in the medical sector?
Regulation.
Okay.
Every professional groups within the health sector as guidelines, as efforts that people practically swear to, that should be with the boundary within which they can deploy their service to the citizens in benevolent and non-maleficent way. So training must be up to date. The training institutions must be, they should be able to stand the test of time. Curricula should be well updated. Certification should be ensured and be put in place to make sure that these practitioners are up to date with their skills. But beyond that, who regulates quacks? That is where the regulatory mechanism. Every Minister of Health has a quality assurance company that ideally should regulate this. But how many personnel are there to move around? Do they even have the logistics support to move around and see and put people who are doing evil and put them in check? So this is the challenge, and I round up on the same opening note that you cannot address health sector out of the general economic framework of any country. It's almost impossible.
Well, and that's a very safe place for us to land this morning. Thank you so much, Doctor. You were brilliant on the show. Thank you.
Pleasure. All the best.
All right.
Yeah.
On record.
Every word matters.
All right, that was Dr. Phillips Olakunle. We've been talking about the decline in Nigeria's health sector and how it serves as a catalyst to brain drain. I'd like to say thank you to everyone who contributed to making the show a great success. But the bigger thanks goes to you for listening and watching. Until I come your way again, I am Vivian Oguche. Have a fantastic day ahead. Bye.
The democracy has not given us peace, but we must tinker with our democracy.
I'm upset with my friend that came before me.
Oh.
Yes, I listened to him.
Looking for a world of education and entertainment? Get ready to dive into limitless excitement on iImpact Full HD TV. Micromsat 42 degrees east. Enjoy a packed lineup of thrilling shows, sports actions, electrifying music, and so much more. High Impact TV, securing the future.